Can you all hear me?
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
So this is very important concept actually. That's why I'm spending time here. Um, um, I told you this will, once you understand these things will become a lot easier during the presentation. You can understand exactly even the presentation, even the symptoms, why it is called acute, why it is called chronic, why these symptoms the patient is experiencing. So once you understand this basic concept, it becomes easier. So you should understand one thing first, that these cells are larger than these cells, these precursor cells. The final cells are larger, the final cells are smaller in size than the precursor cells. The final cells are more functional. These are more differentiated and highly specialized than the precursor cell. That means this cell can do the actual function than these cells. Okay, so these two things you need to keep in mind, because in cancer, in the leukemia, what we'll see is there will be the rapid proliferation of all the cells, not only erythrocytes, but all the cells, and mostly these cells. And because of this, there will be more in number of these cells, but there will be less number of erythrocytes actually. Okay, so you may be able to see more amount of reticulocytes in the peripheral blood smear. Okay, you may be able to see many blast cells. That will indicate that bone marrow is working very hard or very at a high rate to produce more number of cells in the circulation, but you may not see the more RBC or more functional cells. Okay, you may be able to see under microscope and the more amount of these large cells, okay, than these small cells. That is the overall idea to tell you the morphology. Okay, we'll see when we have a couple of slides about the morphology of leukemic cells. We'll see that how big it looks, and in terms of function, you should understand if there is less RBC, definitely the patient is going to suffer from anemia or hemoglobin, or suffer from the lack of function of that particular cells. Am I clear till now?
Yes, sir.
Anybody
Yes,
have
sir.
any doubt here? Nautula? Clear? Anybody have any doubt here over here? Subarna? This is clear to concept? They're not there or what? Or I'm not audible to you. Am I audible?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So this is okay. It's very important for you to understand what is acute and chronic. Okay. Now let me tell you what is acute and what is chronic in this diagram. Okay. Can you guess in this diagram whatever I explained now? What is am I audible clearly to you all? Aishwarya, Divya?
Yes, sir.
Is my voice breaking? Is my voice
Yes, sir.
breaking? Is my voice breaking? Can you all hear me?
Yes, sir.
Okay. I think there was a problem with Superman network. So can I guess now what is acute and chronic? How will you define acute and chronic in this diagram? Or okay, just use your head. If you can't, then I will move ahead a little bit in the slide and then again come back to this picture. No, right? You can figure it now, isn't it? What is acute and chronic? Based on the information, based on the explanation that I gave till now, how will you say that it may be acute or it may be chronic? You are not able to do now, isn't it? Or can you do it? Can you do it?
No, sir.
Okay, fine, completely fine, no problem. We'll come back here. Let me drag this video icon over here. So now let me tell you something about this. Then you can figure out okay what is happening in that cell line is. So leukemia are classified according to the cell of origin. That is very clear to you people. If it is lymphoid, it can be ALL or CLL. But here you are seeing in acute lymphocyte, you see more of lymphoblast. In chronic, you see matured appearing lymphocytes. Okay. Again, for myeloid cell again, or in AML or CML, you will see in acute case you will see myeloblast. In chronic case, you will see mature appearing neutrophils. So basically, what common thing you are seeing from both lymphoid and myeloid in this? What common thing I'm asking? Any common thing you are seeing? Any common thing you are seeing in both lymphoid and myeloid and chronic and acute? Any common thing you are seeing?
Mature cells in chronic.
Correct. Okay. In chronic case, you are seeing mature cells. Very true. And in acute case, you are seeing blast cells. And this is common you are able to figure out, isn't it?
Yes, sir. Yes, sir.
This is very, very important observation. Okay. Now let me go back to the same picture, and now you tell me what is the difference between acute and chronic from here, since now you already know from the slide. Rasmi?
Yes, sir.
So I'm asking what would be acute in this awareness? For example, I'm giving you scenario now. First scenario where the cell line is at this point, basophilic erythroblastic stage. If the proliferation is happening more at this stage only, okay, or there is a problem at this stage only. So is it going to be a chronic or acute?
Acute.
Acute, sir.
Acute, correct. Acute. That's very nice prediction. That's going to be acute. Okay, very, very, very good. This is important to understand. Now you'll realize why it is important to understand. So for it now, if the problem is at reticulocyte level, if the problem is at reticulocyte level, so it is going to be acute or chronic leukemia.
Sir, it will be chronic.
Yes, good. So now you should understand, now you can even figure out the symptoms based on this. That means if leukemia is going to be acute, that means at this stage, that means there is very less amount of erythrocytes or mature cells or functional cells. Am I right? Am I right, Rasmi? If the problem is in early stage of the cell division or the cell formation, that means it's acute, and that also means you have very much less amount of this matured small size functional cells, right?
Yes, sir.
And that also means that you have more amount of these big cells and non-functional cells. And based on this number of functional cells, you can even predict symptoms. Is it, Aishwarya?
Yes, sir.
Okay, so that now you are, Aishwarya, tell me who is going to have more aggressive symptoms, like more aggressive and more severe symptoms, in acute case or in chronic case?
I think acute.
Why do you think acute?
Because they don't have mature cells.
Much mature cell, correct. They don't have much mature cell, and the problem is happening at the early stage. So definitely they will be suffering more because they have less functional cells to do that particular function. So they are going to suffer more in terms of like speed. Okay, that's how we define acute and chronic, isn't it? In our general English medical term, what we know is acute condition of disease is something that happens very rapidly, and chronic is something that happens over a long period of time. So since the patient will have more amount of functional cells in the chronic phase, it will deteriorate over a long period of time, not immediately, isn't it? Does that make sense? Does that make sense, Rasmi?
Yes, sir.
Okay, anybody who haven't understood this concept is very important. Okay, Mehboob?
Yes, sir.
Getting now? Trishella?
Yes, sir.
Okay, so now if the patient is acute, if the patient have acute kind of leukemia, that means the problem is here. They are going to suffer more rapidly, more quickly. The same thing we'll see in the presentation also. Let me take you back to the presentation again. You are able to see here on a CBC. If you see on a CBC, what will you see in acute leukemia? There will be more amount of blast cell, right? There will be more amount of blast cell. Does this make sense? Blast cell will be more,
Yes, sir.
right? Blast cell will be more in
Yes, sir.
acute case.
Yes, sir.
Blast cell will be more in acute case, in acute leukemia. But leukocytosis with mature lymphocytes, consider CLL. If you have more amount of mature lymphocytes on CBC, you will consider chronic lymphoid leukemia. Am I right? Uh, and if you have leukocytosis is increase in white blood cell. If you have leukocytes with mature neutrophilia, okay, especially neutrophils, you consider chronic myeloid leukemia, because you know the cell lineage, what are the cells that comes from lymphoid cell lineage and what are the cells that comes from lymphoid cell, myeloid cell lineage. Am I clear to this?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Moving ahead. Now we'll limit our definition, we'll restrict our definition more to the acute leukemia, and then we'll go to the chronic leukemia. We'll see the complete information about acute leukemia, we'll see the presentation, we'll see the diagnosis, we'll see how the cell looks in the smear, we'll see how what's the treatment, okay, how the treatment differs for acute and chronic. So all these things we are going to see now in detail. Okay. So shall we move ahead a little bit about the definition of acute leukemia, as we already discussed. Then we'll go to the morphological classification and then etiology, all those things in detail. So definition, you know already now, these are the malignancy of immature. Remember, immature means early in the stage. Immature hematopoietic cells. And that is, in other words, if you see more than 20% of the blast cell, more than 20% of the blast cell as immature cell, okay? If the mature cells are more in number in vague term, that's called the acute leukemia, okay? So it can be myeloid leukemia, it can be lymphoblastic leukemia. If you see the age group, okay, in patient with less than 15 years of age, that means generally children and children, they are going to mostly suffer from this. Almost more than 80% of the patient in childhood, less than 15 years of age, they suffer from this acute lymphoblastic leukemia. Okay, that is lymphoid lineage. But in case of adult and elderly, you see like more than 80% of them suffer from myeloid problem, myeloid cell lineage, okay, or maybe acute myeloid leukemia. Is that clear? So you also remember, you might be also remembering that I was telling you these cells differs, this leukemia differs in the morphology. They have the by looking at the cell in the peripheral smear, you can see the many changes, many morphological changes, many structural changes. You will see some of them, some of the nucleus have divided, some of the nucleus have not divided. In some cases, even if divided, not differentiated. Some are binucleated, some are mononucleated, some are mature, some are big, some are small. Many, in some you see some granules. So many things you will see, many morphological changes you will see in these cells. So based on their morphology, the WHO have given the classification to classify this leukemia, okay, acute myeloid leukemia. So it's like if it is M0, I was telling you differentiation and functionality of the cell. If it is M0, that means this is minimally differentiated. If it is M1, that means it's without maturation. If it is M2 with maturation, M3 hypergranular promyelocytic cells you'll see in the morphology. M4 myelomonocytic cells you'll see. M5 monoblastic or monocytic cells. M6 erythroleukemia. M7 megakaryocytic blastics you'll see. And in some rare times you may also see eosinophilia. So in lymphoblastic, whereas in L1 stage, you will see the small monomorphic cells. But in L2 you see large heterogeneous cells, and in L3 you see Burkitt's cell type. Okay, these are like these when I talk about lymphoblastic, I'm talking about T cell and B cell, but this Burkitt's cell type is like kind of cancer where there is not involvement of there is not involvement. These are kind of like non-Hodgkin lymphoma. There is something called Hodgkin lymphoma. So this Burkitt's lymphoma is kind of form of non-Hodgkin lymphoma in which cancer starts in the immune cells, that is B cells. Okay, as I told, these lymphoblastic leukemia. When I'm talking about T cell and B cell cancer. Okay, is that clear till now?
Yes, sir.
Is that clear? So I will wind up the class here because now 6 presentation are coming up at the 9 a.m. So when can we have in the next class we will continue with the remaining portion. So tell me, when can we have this